Here are the top 5 reasons why you should not have tear trough filler. Hi, I'm Dr. Aaron. I'm an aesthetic doctor based in London, and here's what I've learned will make you a poor candidate for tear trough filler. Number 1, if you have malar bags. Malar bags are these pockets of swelling, fluid retention, or puffiness in this upper part of your cheek, just below the under eye area. They can be genetic, they can be age-related, or they can be caused by fluid retention. Having fillers in this area is not a great idea if you have malar bags, because fillers can be hydrophilic. So they act as a sponge, drawing in water, and they'll exacerbate that swelling in the malar bag. The better approach, if you have malar bags, is to have a treatment such as Endolift, which will melt the pocket of fat and also tighten the skin. Once we've got the malar bag under control, then you can have tear trough filler. 2, if you have under eye bags. Now, when we say under eye bags, we mean a false tear trough deformity. And a false tear trough deformity is when the fat pad that's underneath the eye has protruded forward and it looks like a bag. Now, tear trough filler alone is going to actually make that bag look worse, because if you imagine it like a balloon and you're just filling up that balloon with a filler, it's going to protrude further and the bag's going to look worse. In this case, what you actually need is anterior cheek filler, which is front cheek filler. What it does is it's going to bring your cheek into a more forward position. And the idea is that we want to convert that false tear trough deformity to a true tear trough deformity, which means it looks more like a hollow. Once it's been converted to a hollow, we can very easily fill that hollow with a soft tear trough filler, and you'll get a very good result. 3, if you want wrinkles erased. Now, tear trough filler does not erase wrinkles. It only improves a hollow under the eye. For wrinkles, what you want is actually Botox or certain types of lasers, such as CO2 laser, which will resurface the skin. 4, if you have hyperpigmentation only. Now, tear trough filler is very good for improving the brightness under the eyes by reducing the hollow, which then improves the shadow under the eye. However, it will not improve the skin color. And this is very common for a lot of people. If you mainly have hyperpigmentation or darkened skin under the eye, what you actually want is a prescription grade cream called hydroquinone, or there's more gentle treatments such as arbutin. What these do is they regulate your melanocytes, so they reduce the amount of melanin that the cell is producing and therefore brighten the skin under the eye. If this doesn't work, you can also look into certain types of IPL lasers, which can also improve the pigmentation under the eye. 5, if you have poor skin quality. Now, if you have very, very loose skin or crepey skin, or you have festoons, then filler is also not going to be a very good idea, because for tear trough filler to look good, the skin above it has to be tight enough to hold it in place. And if it's very loose, then it's going to look lumpy, bumpy, and it can also cause swelling as well. So if you have very crepey skin, what you want instead is either surgery to remove some of that excess skin, or once again, you can have a CO2 laser to tighten up that skin. And once we've tightened that skin or removed the excess skin, then we can use tear trough filler to improve the hollow, and you'll also get a very good result.